Thank you, everyone, for joining us. We will be starting our presentation on the Master's Program in Humanitarian Health in a few minutes, just to allow a few more people who are still logging in. At this point, you should be able to see our screen with our first presentation slide. Okay, we're going to go ahead and begin. I'm Kelly Curtis, one of the admissions officers here in the department for the Applied Science programs, and I work with our team to assist students as they are exploring their options for continuing education. I would like to introduce Paul Spiegel. He is the program director.
Hi, everyone. Good to see you or hear from you, hopefully.
Paul, would you like to share a little bit about your background?
Sure. Hi, everyone. I'm a Canadian physician who spent most of my life working in humanitarian emergencies. I did, after I became a physician, I worked with Doctors Without Borders and Doctors of the World in the field for a while, and then I actually went to Hopkins to do a Master's of Public Health and a Preventive Medicine residency many years ago. From there, I went to the Centers for Disease Control, where I worked as an epidemiologist physician in the International Emergency and Refugee Health Branch at that time, for about 4 years, constantly in the field responding to emergencies. And then after 4 years, I joined UNHCR, the High Commissioner for Refugees in Geneva, started their HIV program, and then eventually ran health programs in their clinical sections, before finally coming back to Hopkins many years ago, after many years, starting 3.5 years ago as a professor, and I direct the center there called the Center for Humanitarian Health.
Thank you, Paul. So a little bit about this evening's agenda. Paul will cover the industry overview, program details, the curriculum. We'll talk a little bit more about what online learning looks like here at Johns Hopkins University in the Bloomwood School of Public Health with our 20+ years of experience in online learning. We will highlight faculty and their level of expertise. I'll cover tuition and touch on financial aid, the OPAL scholarship that is offered for this program, admission requirements, and we will allow some time at the end for question and answers. So as you're listening to the presentation, if any questions come up, feel free to type those in the chat box. And Paul, I'll let you take over, starting with the slides.
Okay, thank you. So this Master's of Applied Science in Humanitarian Health obviously is very timely, given the situation in the world well beyond coronavirus. But it really deals with conflict and natural disasters, and it is internationally focused. So I think that's quite important because we have had a lot of people in the past who wanted to respond to disasters, particularly natural disasters, domestically. And we have had a lot of people who joined the program who have actually had that experience. I think it's very important to note that this is primarily for and focused on international response. with a focus on conflict, migration, and natural disasters. With everything that is going on, the number of conflicts, sadly, is increasing. Conflicts are becoming more and more protracted in nature, and so unfortunately, the need is increasing because many conflicts are not ending. For example, a refugee is actually a refugee for over 10 years. And so while we have a lot of discussions about with host countries about saying that refugees are only going to be there for a short period of time, or internally displaced persons, those that have not left their country, are going to be there for a limited amount of time, in practice, they stay for a very long time, and therefore we need to be able to respond both in an acute phase, but also consider a much longer phase as they stay, as these conflicts continue to be protracted. There is Humanitarian Health is bringing and focusing on the health of populations. We're looking more and more at integration. In the past, we would look at often the acute emergencies and look at the status of a population, a refugee or an internally displaced person, and then we would focus on them. More and more, we're looking at trying to look at a needs-based approach. And in refugees, well over 50% of refugees don't live in camps. They are integrated with host communities. So we're trying to look at how we can work with governments, with host communities, with development actors to address these problems and these issues in a more of a holistic way, trying to avoid parallel services, working with governments so that we can develop their systems that will help with their citizens as well as displaced persons. There are a lot of challenges in that way because development actors work very differently from humanitarian actors. Humanitarian health is inherently political, very political, and therefore we need to think not just in terms of health, but we need to think in a broader sense from a political science point of view, a cultural and logical point of view, an engineering point of view. So it is a discipline that requires working and interacting in a multidisciplinary fashion. Next slide, please. So our goal here is to really develop the skills, have the students develop both the technical skills as well as be exposed to different contexts, so that ultimately they're going to be, students will come out with a degree where they will feel ready to be able to work with international NGOs, national NGOs, governments, or UN agencies. We really do concentrate on a lot of aspects, operational and service delivery, applied research, and also more and more on public health advocacy, which when we look at everything from what's happening in detention centers across the world, it's very important for us to be able to teach students to use evidence to advocate in a public health fashion of what is best for the population. I mentioned the interdisciplinary program. We have a wide range of lecturers beyond just Johns Hopkins. We have an international network of students and alumni, and so we are bringing in a lot of lecturers, many of whom are in the field and responding in the field, and we actually speak with them and record them. We also try to work, we have case studies, and we try to work with you to apply what we are teaching in different contexts, because you'll hear this consistently. People can hear you. Okay. I'm not sure who was, oh yes, sorry. I was just reading what was on the screen. The one thing about humanitarian health is that contexts differ from camp-like to out of camp, from middle income to low income, to refugee to internally displaced people, to what we're seeing right now, which is a lot of mixed migration. So we're looking at in places like Libya, where you have humanitarian components of people fleeing Libya. But you also had many guest workers that were actually working in Libya that have also had to flee. And more, and I think Court Robinson is on the line. Oh, now I see him.
Yes, greetings all.
Okay, hi, Court. So he has worked a lot in the migration field, and we're trying now, I think, as a discipline, to be able to look at the multitude of factors of why people move. And yes, many people are moving because they feel severely threatened. But we have a lot of other examples, such as in Venezuela right now, where there are many people that are threatened, but you also have a breakdown of government. So the reasons why people move are multifaceted, and we need to take that into account. So the curriculum examines the determinants of health, looking at medical care, public health, mental health, sexual gender-based violence, personal behaviors. And as we mentioned, we're trying to bring in viewpoints from various disciplines. And as we have expanded and continued in this program, we are also learning how, I think, how best to work with students online, because we won't be seeing you in person for the most part. And so we're teaching this in a variety of ways, but I have a feeling that may be on the next slide.
Paul, this is Kelly. The audio is not very clear, so I don't know if you can adjust.
It's not very clear? Is it better like this?
That sounded better.
Yeah, that sounded better. I wasn't sure if it was just me. I could hear you, but it was a little murky.
Okay.
Thank you.
I think that's better.
Okay. So the idea here is we know that many people will be mid-career. People will be working throughout this, so that we're taking into account in the way we are trying to teach these courses are in bite-sized lectures, so that people can listen to it at different times of the day. We are cognizant of it's often an older group who have not studied for a while, but it may vary, of course. So we're trying to take all this into account with the ultimate aim, as I mentioned at the beginning, of providing you with the knowledge and we hope the skills and the different contexts. We can't provide you with actual experience, so that you will feel prepared when you apply for jobs in this area. There's clearly a high demand, and Court, I'm sure when we take some questions, Court could discuss. We had a seminar today where we had a lot of recently graduated students who are talking about their careers. And one of the challenges always is moving into a career where, let's say, moving from a career to a different career. We've had people that have been working domestically in disasters and want to move abroad internationally. We have people that have been either physicians or nurses and then move into more of an international field. And there will always be this tension, let's say, between teaching and what we can expose you to, and then the experience. And so there are lots of ways to try to get experiences in the field. As we mentioned, there's something called Release Web, where you can look online to see all the various jobs that are available even in this area. There's clearly a high demand for both the administrative component as well as the management and response component. Possible jobs that we've listed them here, but certainly non-governmental organizations, both international and national. We are hopefully attracting an international group here, not just Americans, but across the world that we're taking this master's. UN agencies, CDCs, we mentioned, and similar agencies across the world, various think tanks and policy organizations, as well as response agencies. Next slide. So we have 49.5, so it's basically 50 credits for terms in 2 academic years. many people are not able to do this in 2 years or don't wish to do this in 2 years. So it's not unusual. We are in our second cohort. So this class is upcoming class will be our third cohort. Some people do it, I would say maybe half, 3/4 actually do it in 2 years. Others prefer to do it in 3 years. It's a mixture of courses and then some professional development activities, and we culminate with what we call an integrated activity. And we can talk a little bit about that. I'll save time for questions afterwards for the integrated activity. But the idea of that is really it's a 4-credit activity that Court, myself, and other faculty will work with you on to do a project that takes into account both your interests as well as what you've learned. And there are a variety of places you can look to do, from developing proposals, from doing literature reviews, on
Paul, we're getting some audio problems with you, and I just wonder if we could check in with some of our attendees if they're having issues, because I think a lot of what you're saying is very important, and it's just coming through a little bit murky. And I just wanted to do a sound check and make sure that people are kind of getting what you're saying. I know they can see the slides, but just if we could do a quick check-in, if folks could sort of digitally raise your hand or signal that you're either getting 100%, 75, 50% of the audio. And I guess that applies for me as well. I'm not sure if it's all of us or just one microphone or just what it might be, but I think we're Megan and I are having some trouble hearing you, Paul, and just want to make sure that's not happening to everybody.
So, Court, this is Kelly. I can hear you, and the feedback we're getting is that they're hearing about 1/4 of what's been presented so far, but they can hear you very clearly, Court.
Court, why don't you take over, and I will. No, seriously, take over, and I will try to get the headphones and the microphone.
Yeah, so you can get a sound check. Anyway, greetings all, and Cortland Robinson. I co-direct the Master of Applied Science in Humanitarian Health with Paul. I'm core faculty in the Center for Humanitarian Health and work on a lot of different issues in the humanitarian health space, including work on child marriage and humanitarian emergencies, human trafficking, estimates of mortality, and I think as Paul mentioned already, a lot of work on that what we call mixed flow migration. So it's not always clear when people flee or move in the context of either natural disasters or even sometimes in the context of conflict. Are they moving because they're fleeing persecution? Are they moving because they are trying to adapt to very difficult circumstances by going to a place where they could maybe get a job, get their kids in school, follow family members? And so we want to look at some of the different motives for people who do move in these humanitarian contexts and how we think about the impacts on health. In terms of the role that I play in the MAS in humanitarian health, I co-teach a course on assessment approaches in humanitarian emergencies, looking at qualitative, quantitative, and mixed methods research and evaluation methods that we hope will apply to people in the field. And I think, again, as Paul mentioned, we had a career panel, Careers in Humanitarian Health, and one of our recent graduates wrote a very glowing note to us saying, I'm using what you taught me and it's working. So we're very pleased to get that kind of feedback. I also teach a course on human rights in humanitarian health. Actually just finished the last live talk for that class, looking at how human rights issues come into play in the humanitarian response and how they are sometimes in tension when one focus is to just do your job, provide health, And another perspective says there's a human rights dimension. What if this calls for advocacy, action, maybe even protest? How do you reconcile the humanitarian action with the human rights obligations? And what do you do when they're in tension? And also co-teach with Paul the integrative activity, which is the culmination of your degree program, tying it all together, producing a research paper or a policy brief or a program evaluation that can very much map to what you're doing already, highly encouraged, or take you in the direction that you want to go in, and see how you can use the degree overall and the integrative activity to get you to that next place. So we are targeting this toward working professionals. It's 100% online these days. That's the place to be with coronavirus calling for social distancing. More and more is going to be online, so this would be quite the degree that makes sense under these circumstances. But it doesn't take a pandemic to suggest that online part-time teaching really is an important vehicle, an important option for folks in the humanitarian arena who want to continue to work and get a degree as they go. I would say in their spare time, not that you have a lot, but so far people are managing. We do a lot of different kinds of teaching and learning, a lot of peer assessment group projects, a lot of hands-on. We try to be as interactive as we can, even in an online space. So we do a lot of things like live talks, interactive discussions. I had a case study today looking at a situation that occurred a number of years ago in a refugee camp, and how the group, the class would process sort of what different roles might and perspectives might come into play when you're addressing a dilemma, in this case, reports of sexual abuse in a refugee camp at the hands of national security, and how an organization working in that camp balance the need to stay, remain, provide health services in a hospital, but also address this very critical element of not only gender-based violence, but rights violations by national security, and how to do that and do advocacy while also doing other work that's required of you as clinicians or health workers. So again, we're trying to build a understanding, a set of skills, a set of knowledge, a set of competencies that help you work within this very dynamic humanitarian health space. Why don't we go on to the next slide? And Paul, if you're...
Yeah, I'm back. Is this
I'm
better?
back and better than ever. So here we are. Do you want to take this or?
No, go ahead. But
Okay.
can you hear me at least?
Much better.
Okay.
I can.
Good.
Yeah.
Go ahead. No, it's fine. Please.
Okay. So first year, we work by terms here, 8-week terms. So you'll be doing typically about 6 credits per term. And I won't walk you through every single course. I think they're there on the slide for you to look at, but you can see how they cover everything from more general intro courses like public health and humanitarian emergencies to disaster preparedness, highly critical these days, water sanitation, intro to EPI. So we do introduce courses in our degree that also map to broader skills. So some of the courses you'll see are citing phrases like humanitarian emergencies. Others, like epidemiology, statistical concepts, are broader and we think are are relevant to people working in humanitarian health, but also more broadly in other arenas. By year 2, we dive into things like assessment approaches. That's, of course, I co-teach, health needs, service provision, nutrition, food security, leadership management. Paul is involved in a number of these, as well as instructor, co-instructor. I mentioned the human rights course, which is 3rd term, just wrapping up this week. And then finally, NGO administration of health programs, a broader course, and then the integrative activity, which wraps it all up with a paper product of some kind, either a proposal, a research paper, a policy brief, and also a verbal and visual presentation, because one of the things we want to emphasize is that this kind of work involves a lot of interaction with the public, and we think along with writing and analysis of data and critical thinking, you need to be able to make presentations that are coherent, engaging, and we hope above all persuasive. Next slide. Do we have another slide? Yeah, so this is a little broader. I think we do a lot of this. We have Hopkins was really in the lead several decades ago doing online learning. So we think we know what we're doing, and we think we bring that knowledge and experience to you. We have done a lot of recording of lectures. We will try to maintain those over time and keep them fresh and up to date and timely, while also providing those core skills and knowledge content areas that we think are really fundamental to an understanding of humanitarian health, with a focus on sort of public health perspectives, but helping you also build, enhance a number of the other professional skills that we hope through this degree will help you proceed in your career, or possibly move into new roles and new opportunities in the humanitarian health arena. Paul, anything else to add on this, or anyone else? Some of this is a little more sort of general about the program, not just humanitarian health specifically.
No, I think it's good to finish up sooner rather than later, and then we can hopefully hear from anyone online.
Okay. I just can't remember exactly how many more slides we had left. So
yeah. Next slide.
Yeah. The esteemed most director.
Oh yeah.
Oh, this is slightly old. So yeah, I've been promoted. One of our colleagues has moved from program directors. But anyway, this is our staff, the faculty, I should say, who teach these courses, and they are in international health. They're in epidemiology, biostatistics, mental health, health, behavior, and society, I think, health policy management, a whole array of different entities, population, family, reproductive health, are just a number of the different departments that contribute these courses in the humanitarian health MAS.
Maybe we can add that if you do go onto the site called the Center for Humanitarian Health at Hopkins, if you do search that site, each of these, or nearly everyone that is on there, will have a bio, and you can read a little bit more about what they do and their background.
Right. Okay.
And I know that's the last slide. I think we move to Kelly.
Thanks, Paul and Cortland, for providing great insight into the program. So I'm going to touch on the scholarship information. There is an OPAL scholarship that is available to the Masters of Applied Science and Humanitarian Health. The OPAL scholarship is $446 per credit hour. That is taken off the cost per credit hour. We also offer 2 $10,000 scholarships for applicants from low and middle income countries. These scholarships, a $10,000 scholarship, is dispersed over the length of the program. Applicants to receive the scholarship must meet all admission requirements, reside in a low and middle income country, and submit a completed application by May 15th for these two $10,000 scholarships. So the tuition currently is $1,162 per credit hour. With the Opal Scholarship of $446 per credit hour, what the student ends up paying is $716 per credit hour. And with 49.5 credits in this program, the investment currently is $35,442. You're paying for these classes or credits as you take them in each 8-week term. There's no additional steps that one needs to do to receive the Opal Scholarship that's awarded for students accepted into the program. Beyond the Opal Scholarship, information on financial aid is on this slide. And if you're interested in exploring those options, our school code is E as in excellent 00234. So I'll touch on the admission requirements. We use a centralized application portal called SOPHIS. We require a bachelor's degree from an accredited college or university, a minimum of 2 years of public health or humanitarian work experience, a current resume or CV, 3 letters of recommendation, preferably for those that you work for, a statement of purpose that shows your compatibility of your career goals with the educational objectives of the program. And this is really your time to explain, what you've been doing, what got you interested in the program, what you're trying to learn, and how you're planning to apply it. For our international students, you may need either the TOEFL or the IELTS exam. And for any coursework outside of the United States, we do need a course-by-course evaluation, and we do recommend using WES or World Education Service. So we do review completed files on an ongoing basis. We encourage students to apply early. We already have accepted students in the program. Our priority deadline is coming up here soon. It's April 15th. Again, for those in low and middle income countries that are interested in being considered for the two $10,000 scholarships, that deadline is May 15th. And then final deadline is June 1st. We do have just one start a year, so if you are interested in this program and you don't want to wait until fall of 2021, we do encourage you to start your application. So I think we have time for questions and answers. If you have any questions that you haven't typed already in the chat box, please do so at the moment. Okay, so it looks like the first question has to do with what you're looking for in the background of an applicant, experience, academic. Do you guys want to answer that student's question?
Sure.
You want me to do that, Paul, or?
Let me go because they haven't heard my voice at all, sadly, because I was.
That's right.
So I apologize everyone for those that are online that the video wasn't good. So it's Paul Spiegel, and we are looking, what we found over the last few years at least, is it can be quite variable. Obviously the minimum academic requirements that were discussed, but then following that, we have seen quite a variety of students who have applied. In terms of experience, we would like to see experience abroad. If you're from let's say North America or Europe, we would like to see global health experience. It doesn't need to be extensive, but I would say the more the better. I think the more that you have, the better. The more applicable I think of what we will be teaching. But we have had some, particularly some nurses and doctors and even physicians assistants who have had some limited international experience, but have had quite a lot of national experience in response to hurricanes, etc., and who want to expand to go internationally. And this also we found in the end has been acceptable. You know, at the beginning we were concerned, but we've now been working with these students for a while, and it seems that a lot of what they know and their experience is transferable. So that's another area. And then in terms of academic, beyond just meeting the minimum requirements, is that we're talking for the most part mature students who have had a lot of life experience, and so we don't need by any means healthcare workers alone. We've had different groups from different persons, from those that have worked very much in program and program management, in administration. We're not looking necessarily for by any means a clinician. What's key, I think, in in humanitarian health is to have different groups of people working in different ways to deal with a very complex situation.
Thank you, Paul. The next question I think I can answer. A student is asking if we require the GRE or GMAT. We do not. We do look at the student's entire file, for an acceptance decision. There's another question on time commitment, and I know Cortland touched on a little bit about what the courses look like, but anything you want to add with if a student is taking the 2 classes in each 8-week term with the expectation of about 18 to 20 hours a week, can you add a little bit more of what that week would look like?
Yeah, I can jump in on that. So it depends, of course by course. I'll just give you examples from the courses that I know because I teach them. So we will have, depending on the number of credits the course counts for, you might have 1 videotaped recorded lecture per week. You might have 2. That would be accompanied by readings. That would be accompanied by periodic live talks where we get together and sort of talk about the readings and the lectures and sort of what is coming up in your thinking and your reading and discussions. And then some courses would have periodic quizzes. Others might have a final paper or some other project or some combination. So we build in different kinds of assessments. Obviously, part of what we need to do to assess your progress is to make sure that we have some documentation of what you've been learning and how you can express that knowledge and skills, analytical capacities in some kind of an assessment. So there will be likely days or weeks in over the 8-week term that are busier. And in some cases less busy. So far, I think we've seen people feeling like they're able to manage. So 6 credits, the sort of rough translation of that is 6 credit hours would be, as was just mentioned, something like 12 to 18 hours of reading, writing, some application of that lecture and format into some sort of quiz taking or paper writing or live talk or presentation. So that's I think the rough distribution. And of course, some people find that particularly in the humanitarian field, they may have to scale back a bit, and we are flexible. So it's a 2-year program. I think, am I right in saying that we have over a course of 3 years in which to complete this? I'll yield to Kelly or others on that. So we do try to be as flexible as we can, but generally it's 6 credits, generally about 12 to 18 hours, some reading, some writing, some quiz taking, and we hope also thinking about how what you're learning might be applicable both in the work that you're currently doing or work that you would like to be doing.
I would add perhaps what I do, and I think you do too, Cord, and because of being online, we want to make sure that you're interacting not just with us but amongst yourselves. So we also have discussion forum that are part of the courses, and what I try to do is once a week I put on a question that relates for my courses that I'm teaching. It may be, for example, currently I'm just finishing up a course on water and sanitation, and I wanted to bring in the coronavirus and what sort of things could we think about in let's say humanitarian settings for the coronavirus related to water. So what we try to do is then have interactions both amongst the students, the TA, and the faculty.
Right.
Thank you, Paul and Cortland. This kind of brings up another question. If someone is not able to attend a live lecture, what's the flexibility?
Yeah, so these are, a transcript is available. So this comes up a lot. If you cannot attend a live talk, and we certainly do encourage that because this is your chance to talk live and interact with us. And we really appreciate that and interact with each other, as Paul just mentioned. But if you can't, then that whole conversation is recorded. You can simply log on to Course Plus, click on Live Talk, and you'll see if it's a particular session listed, it will note video, audio recording available. You can listen to that and then basically catch up on what's been discussed. Obviously, you can't contribute in real time, but you can certainly track that. And then if we, as part of our assessment, would be to say class participation is counts as part of your grade, we can then look at that and make sure that people who couldn't attend live for a given session would be checking in on that. So it's a way for all of us to interact with each other, and for you to have the flexibility for whatever reason, work simply is overwhelming or some other obligation comes up, to be able to view and listen to the live talk, as well as, of course, lectures on at times and schedules that work better with your schedule.
Yeah, thank you for clarifying the flexibility with the live talk. I think we have time for one more question. What kind of networking opportunities are there?
Lots. Paul, do you want to?
Yeah, sure. Well, I think
jump in. Yeah.
we can. I mean, there are many. Number one is with the students. Number two is the center, and I do encourage you, and I think we can even show you. We can show you if there's another talk in the future on this. But if you go to the center's website, you can actually see both. The Center for Humanitarian Health, you can see both the faculty that are part of this, but we have associates and we have affiliates, all of whom are around the world. And in order to be an associate and affiliate, they've agreed in theory, there's always limits, but that they can be contacted. Then you can also look on our projects site. So we update that every 6 months or so, and it's all of our various projects that we're working on throughout the world. And so what I found at least over time with the cohort that I've been working with is there's usually a subset of students that get together and are really working together on the various projects. So there's networking amongst yourselves, and then there's networking amongst the faculty and those affiliated with the center.
Yeah, I would just add to that as you all are interacting with us and with each other, whether it comes up in sort of course discussion, so if maybe human rights and saying, hey, there's a notice on reliefweb.int, which is one of the major sources for vacancies. Somebody says, hey, I noticed that, International Rescue Committee is looking for such and such a position. So we do try as much as we can and encourage the students to communicate with each other, and they are. We have a lot of good information that is in fact happening, that they're sharing in real time. Project opportunities, work opportunities, research opportunities, readings that may enhance something they're working on as part of a course. So we really do want to encourage you as a sort of a cohort to be there and supportive of each other, but also for us as faculty, and I think the school as a whole, to bring the resources we have to support your interest in taking this degree and applying it into the next job.
Thank you, Paul and Cortland, for providing really great insight into the program. That is all the time that we have for this evening. Thank you, everyone, for joining us. If we did not get to your question, our team on admissions will contact you in the next few days, and you can reach me directly. My contact information is on the last slide. If you are excited about the presentation and see this as part of your future, please feel free to use the scan code here to move forward with the application. We do have a dedicated admissions team who is looking forward to working with you. Again, thank you everyone for attending, and have a good evening.
Thank you all. Be well. Wash your hands.
Goodbye, everyone. Take care.
All right.
All right. Take care.